The title of my talk is Human Growth Factors, Skin Rejuvenation and Anti-Aging. Where are we? I represent a company called AQ Skin Solutions. The president of the company is called Dr. Ahmed Al-Khatani. He's actually assistant professor at University College of Medicine and Health Sciences in United Arab Emirates. He's in Japan at the moment. He's basically been researching and has developed a skincare line with very novel technology. So it's very unique. It's only one of two companies at the moment in the world that have this kind of technology and have a patent for it. So what I'm about to tell you, it's completely new and I hope you'll find it very interesting as well. The products are out in the market. It's a global company and they're very popular. The company is actually based in US, but the products are marketed throughout the whole world. So not only does he have patent in US, but also in Japan and the whole of Europe. So what are growth factors? So in order to understand how the products work, we need to go down to the basics. So growth factors are, as you know, they basically act as communication between the cells. And what they do is they bind to receptors on the cell surface and they cause this sort of chemical sort of a cascade, and it ends up in the nucleus where they actually cause either turn on gene, they trigger either activation of transcription factors, and which leads to genes being turned on or off. So they're very important in the way the cells work and what they do. But in order to get cells in order to get the growth factors to do what you want them to do, you have to have the right combination of growth factors. That's the key thing, because some growth factors, as you can see, they can cause inflammation, and some growth factors can be anti-inflammatory. So what you use is very important. You need to pay attention to that. And like for instance, the growth factors that we want are these. So if you want to stimulate collagen production, you need to use transforming growth factor beta 1, 2, and 3. Platelet-derived growth factor, that's really important for improving wound healing and creating new blood vessels, so increasing the blood supply. And then you have the GM-CSF, which is really good for stimulating production of the cells, and then interleukins, which are really good anti-inflammatory agents. So this combination of growth factors is the best. So this is what the company has done. AQ Skin Solutions, they've come up with a technology to get that correct combination of growth factors, which will then lead to the results that I will be presenting. So that's the technology is called growth factor induced therapy. It is novel, it's unique, it's only, like I said, it's only one of two companies using this kind of technology. And the way it works is that they cause fibroblast cells to produce the right amount of the growth factors, the correct growth factors that you need. And then they take the growth factor rich media, and they put it into the products. And as I said, they have a patent for it as well. So that's the best thing about this. Because of course there's a lot of companies out there, they claim that the products can do this and they can do that, but they don't have any evidence for it, that they haven't done any research. But the great thing about this company is everything is backed up by evidence and a patent. Now, is growth factor, so you might actually wonder to yourself, okay, that's fine, it's good they're doing this, but is it actually safe to use? Yes. Growth factors are naturally found in the body, we all know that, so there's no chance of reacting to it. Growth factors act locally and don't enter the bloodstream. That's the important thing. They cannot be recycled by the body, and it allows the use of growth factors in cosmetics. So FDA is aware of this, and hence why we get the patent. Now the first product I'm going to talk about is called AQ Recovery System. So it looks like this. So you have it in your brochures. So it looks like this. Okay, so I'll just open this to show you.
I didn't get the brochure.
Oh. So it looks like this.
I didn't get the brochure.
I've run out of brochures, but I'll give you one of these. There you go. Okay, so it comes in a little vial like this. And then it comes with something we call a derma stamp. So that's the derma. So you all heard of microneedling, microneedles, yeah, derma rollers. This is a different thing. It's not a derma roller, it's not microneedling. The needles are even finer, okay? And the technique is a little bit different. You don't roll it, you're basically stamping, okay? So you're covering a wider area every time you apply it, and it pushes the product in. So the reason why it comes with this sort of device, because we want the product to actually get into the skin, because that's really important. Because when they've done the studies, this is without the skin stamp. So as you can see, when you do regular good studies, the product you can't, this is when it's highly magnified, and you can see just little amounts get into the skin. But when you actually use it with a skin stamp, so you can see it penetrates. Why does it penetrate? Because the needles at the end of the derma stamp, they create little puncture sites, and that pushes the product, that helps the product to get into, it creates little channels. And you need something, otherwise your product that you're going to put on the top of the skin is not going to get into the skin. Okay, so what does it do? Wound healing, okay? So it has many functions. The products do a lot of things, and I'll go through it step by step. First, wound healing. So here, as you can see, this person has had breast reduction. Now, because the patient smoked 2 packs a day, you can see you have some sort of degree of necrosis here. But what happened is they applied, so Dr. Mello applied the AQ recovery serum and changed every 3 to 5 days. You can see just after a month, okay, so you can see the improvement. Now, obviously, if without this, the necrosis would have never been healed. You know, once you get necrosis, that's it, you can't do anything. But the amazing thing about this product is that the growth factors start to, as I mentioned, stimulate the cells to multiply. They cause angiogenesis, so they create new blood vessels, because that's what necrosis is, right? There's no blood supply, the cells are dead. So what this does, it basically helps the tissue repair itself. So essentially creating new tissue. This is another example of wound healing. So again, you have a lady, type 2 diabetes. Now, as you know, with type 2 diabetes, once you get these lesions, that's it. They are so difficult to heal, because type 2 diabetes, again, they have compromised vascular system. You know, it's how is it going to heal? Now look at this. So this person has been using just topical creams for 6 months, no improvement. So this is how it was. And this is what happened after using 29 days using the AQ recovery system. And look at this, you're starting to get healing. So again, in terms of wound healing, this is really good. This is a post-knee replacement surgery. So again, you know with surgery, you're going to get scar tissue. Sometimes it doesn't heal very well, again, because of patients, you know, they may be immunocompromised for various reasons. So there are risks with surgery. But, so this is 7 days after using the solution, and then 6 weeks. So you can see it's really good, very good improvement in the scar. And I think that's really important, because people don't realize how much scars can affect a patient's confidence, you know. Even if it's On the knees, ladies like to wear a skirt. So in terms of helping the patient recover well, it's very important to actually consider long-term, the effect of the surgery. So you want to get the best result. As doctors, you want to get the best result to your patients. So again, this is another case, 28, just 1 month. You see it's really nicely healed. And then this is another case that you can hardly see the scar. So without it, as you know, if you've done any surgery, you probably notice that the scars are quite obvious, sometimes depending on what sort of surgery you have, but this is really good. You get really nice improvement with this. Now C-section, obviously we all know with C-sections, sometimes the tear doesn't heal well, and that's a big thing because it can lead to infection. So we really need, in some cases, you do really need to help the wound to heal. And this is amazing because as you can see, the tear, I mean, what else would you do in this case? So here, you can see just by applying the serum, it's completely healed, okay? So again, just purely because of the technology, because of the growth factors, because of the properties that they have. Here is a nose operation. You can see the scar, but it's completely disappeared now. Again, we have here, this person was in an accident. Now this is really important when it comes into the hands because you're going to get contracture once the tissue starts to heal. It's sort of, the way it heals is that it brings the two tissues, the two sides together, right? So it can really cause stiffness. You won't be able to gain function 100%. But the nice thing with this is that, as you can see, there's very minimal contracture, so it's almost back to normal. Another function of this product is scar treatment. So we touched on sort of wound healing, but the nice thing is that it's not just for fresh wounds. If people have already, because we talked about like acneic scars, but in this case, when you have like a burn scar, so this patient had a burn, I'm not sure exactly when, but as you can see, this is an old scar. But what, again, as I mentioned, what happened is when this wound healed, again, you're gaining this contracture, so this tissue is really stiff. So what this patient could not do was walk properly because the skin was too tight. So what you want is you want some excess skin to help the leg move, and that's what happened. After 2 years of applying this product, you can see that there's excess tissue now, and that helps, as I mentioned, because the growth factors are helping to stimulate skin production, stimulation of the cells, so you're actually making more, helping the epidermal cells to grow, to produce and multiply, and so you're getting this excess skin, and that really helps with function. Now, we talked about acne before. Now, this is really amazing what it does for acne. Now, there is already evidence that in the literature that growth factors help with acne. How do they do that? They reduce the sebum levels. They help stimulate, they help increase the hydration in the skin. Okay? So, using the AQ recovery system, so you can see after just 1 month, already you're getting an improvement. And then this is after 2 months, completely healed.
It's not even 2 months, it's 2 weeks, isn't it?
April, May, March, April, May, 2 months.
April 18th to May 1.
March 15th, you start.
No, next one.
And
April
then
18th to May 1, in 2 weeks.
No, you start
this
in
is
March,
the same.
same
March
person.
15,
Oh,
yeah, same person, and then you got first
oh,
of May, yeah.
okay.
Because the way the treatment is done is once a month, so you actually don't need to apply it every day. It's literally, they come in, you do it with the dermastam, okay? And now this is, ideally this is done in the clinic. You basically apply it, they go home, they come back in once a month, and you can do the treatment. And this should last for 2 treatments. This should last. This basically is used for the same patient, and is used twice. Yeah. But what you can do, if you have any extra solution left, they can always take it home and sort of use it themselves at home. Okay. So here we've got, again, if you look at acne scarring, so you have some, as you can see, you have some active acne here, and again, April, July, and by August, all the active acne is gone. And of course, you know, we're not saying that it's really, the scar that's left behind is a bit more difficult to treat, so that requires other forms of treatment. Okay, pigmentation, again, we talked about pigmentation is a big thing. So again, there is actually evidence in the literature that growth factors can inhibit tyrosinase activity. So here, this lady, some form of melasma here, very difficult to treat, but you can see that it's definitely lessened after about a month. It's very, I think it just looks better on the actual screen than here, I think because of the lighting. But if you look on the, yeah, on the laptop is much better. Post-laser treatment, for those of you who have laser or have practitioners who actually use laser, of course when you have laser, it can look like this, and that's without recovery serum. But then after 10 minutes, you can see that there's areas that the redness has already gone down. And you only need to apply once, after laser, and that's it. You just apply it, send them home, and that will just continue to work. Yeah, especially, I would say, especially good after laser, because of course the laser treatment is sort of slightly affects the epidermal layer, the top layer of the skin. It means it's compromised, the skin barrier, so it allows the product to really penetrate quite deep. So that's nice. That's why it allows it to heal really quickly. And another really good benefit of this product is that, remember, with laser you can get post-laser hyperpigmentation. Okay, so that's a risk. But the nice thing is that there's already evidence, there's literature available that shows growth factors can reduce the risk of post-laser hyperpigmentation, post-inflammatory hyperpigmentation, because again, they work by inhibiting. They work by increasing the hydration. Right, now another one of the products is called Advanced Hair Complex. You should have it in your brochure. The Advanced Hair Complex is again with injections like mesotherapy, or you can use it with the derma stamp. And these are the results. So after 15 weeks, you can see that the growth factors have really helped to stimulate the hair follicles to the hair to grow. Okay. And this is after 22 weeks. And if you look under the microscope, you can see that the hair compared before. So as you can see, the hair follicles, the hair is really thin, you can barely see it. The hair follicles seem dormant, some of them. The hair is shorter, thinner, more fragile. But after 15 weeks, you can see that the hair is thicker, the hair strands seem thicker, longer, and the hair follicles look more active. Now they have another product called AQ Lash. So the products are not just for the growth of the hair on the head, but it helps grow the eyebrows and the eyelashes. Okay. And the great thing about these products is that there's no harsh chemical or preservative, because all the active ingredients is basically the growth factor, so you don't have anything extra added. There's no hormones, there's no prostaglandins, and for the lashes, disposable applicators, because obviously with the lash, you have to be careful with the risk of infection, introducing infection contaminants into the container. Now, another thing that these products do is anti-aging. So for the skin, obviously we know aging, obviously we all know what the consequences of aging are: wrinkling, laxity, dryness, and general thinning. And these are problems that are so difficult to treat. Of course, these days we have a number of treatments that we can tackle these, but something that we can use topical, something that's easy, that can take very little time in the clinic is really important. And also something that's natural, because we're sort of moving away from just using Botox and fillers. We want something that stimulates the collagen naturally. And so what happens with older skin, you're getting less collagen production and decreased concentration levels of growth factors. So a lot of people talk about, when we talk about aging, we're talking about less collagen, but we have to remember also that the growth factors are becoming diminished, okay? And there's already evidence that in the literature, again, that to show that the growth factors help with sort of they have anti-aging properties in terms of they're fighting against ultraviolet skin damage, and they help repair the wrinkles and reduce the number of wrinkles on the skin. And they do that by stimulating collagen. So there's two products, again, these are in the brochures. So you can see active serum and the eye serum. Okay. Now if you're using it together, so with the eye specifically, especially, you can see that the hollowness is reduced, as you can see here, and also with the nasolabial, they're less deep. And generally, as you can see, the skin is lighter, much more brighter, and this is just after 2 weeks. Now, there's also another product called the Vaginal Rejuvenation System, and again, this is something that is a lot of companies neglect, and is something that, again, is a trend that's starting, because women are becoming more confident to talk about issues that affect their sexual life, affect their confidence, and AQ Solutions have acknowledged that this is a common, theme, and it is becoming more and more popular, and we need to address it. So what the device does is improves the vaginal dryness. So this is very common, as you know, after menopause. And overall, and not just, it's not just for menopausal women, but just generally, overall vaginal conditions, secretion and odor, which can happen with certain bacterial infections. Improving the blood circulation to make it more sort of what we call juicy. And improve sensation during sexual intercourse. So, and actually this is what 73% of women have actually agreed that this does that. And again, it's because of stimulating collagen production, thickening the mucus layer of the vagina, so that it becomes, as I said, more vascular and more moist, so that it helps with during sexual intercourse. And also by maintaining the pH, again, that helps with the secretion and odor. So, in conclusion, the GF technology that's used in this product, it's safe, it's relatively inexpensive, it's selective. So, as I mentioned, the technology really focuses on the growth factors that really stimulate and do exactly what we want it to do. You don't need anything, you just need the products, and you need, as I mentioned, the demo stamp, really good. It's constant, so you will always get results. It's time saving, very quick. I mean, this kind of treatment in the clinic takes 10 minutes, maybe less. There's no preparation, you don't have to apply anesthetic cream. So as opposed to injection, none of that. Patient comes in, client comes in, clean the face, apply it, client goes home. Simple. Clean, high patient compliance, patients love it. And like I said, they can use this twice, and they always come back. And now you might be wondering, but why this company? You know, there's other companies, yes, but as I mentioned, there's only 2 companies that have their technology patented. They're safe to use. You know, you need to trust the brand. There is some out there that are pretending to use this technology, but you have to be careful because they can actually lead to adverse effects, and this has actually been noted. Thank you very much.
Thank you.
Thank you.